What if a small handful of nuts, something you think is healthy, was slowly harming your heart, brain, and bones? It might sound hard to believe. But as a doctor, I've seen this happen more than once. And one patient completely changed how I look at nuts. Her name was Lorraine. She was 72 years old, her husband had passed away, but she was still smart and liked being with people. But she was always very tired. She came to my clinic and told me about feeling like her brain was foggy, her joints were stiff, and her legs felt strangely heavy. She didn't have any specific disease, just a slow, steady loss of energy, a worse mood, and trouble moving around. It didn't make sense until I asked her what she ate for snacks every day. She smiled and said with pride, "I only eat healthy nuts, like almonds, cashews, peanuts, and macadamia nuts. I don't eat junk food." That's when I stopped and thought. You see, after you turn 60, your body doesn't handle food the same way. Some foods that used to be good for you can now cause problems. And sadly, some of the most popular healthy nuts are the main problems for older adults. A careful 12-year study in a well-known heart journal showed that certain nuts can increase the chance of serious heart problems in older adults by a very high 48%. This is not just a rumor, it's proven science. So, I did what any caring doctor would do. I asked Lorraine to stop eating 2 of the kinds of nuts she ate daily and keep everything else the same. What happened next surprised even me. But I'll tell you more about that soon. In this important information, I'll show you the 4 best nuts that really help you age well. They give good things to your brain, make your bones strong, and improve your blood flow. I will also tell you about 4 nuts that seem healthy but could be quietly harming your memory, blood pressure, or gut health. And very importantly, I'll show you the one nut, yes, just one, that has been worrisomely connected to liver damage, kidney problems, and even a decline in thinking in older adults. I don't want to scare you, I want to help you. Because after 60, every bite you take is very important. And if you're like most older people I see, you're not following trends that don't last. You're really trying to feel better, move better, and protect your independence strongly. So, let me explain this one step at a time. No big claims, just the simple truth. And yes, we will go back to Lorraine's amazing story, because the change that happened just by swapping one type of nut was much better than either of us expected. Let's start with a nut that's more important than people think, the Brazil nut. Full of selenium, this simple but powerful nut supports your thyroid, calms your nerves, and may even help protect your cells from aging. Let's go back to my patient, Lorraine. When I found out she ate mixed nuts every day, I suggested one small, powerful change. I told her to stop eating cashews and macadamia nuts and to add just one Brazil nut each morning. She looked confused. "Only one?" she asked. "Yes, because this tiny nut is very strong. Brazil nuts have the most selenium of any food. Selenium is a mineral that is very important for good thyroid health, healthy nerve signals, and cell repair. Just one nut gives you an amazing 137% of the selenium you need each day. That's not a mistake, it's packed with good nutrition." Lorraine showed all the common signs of a thyroid that wasn't working well: low energy, slower body processes, and mild sadness. She didn't need pills, she really needed selenium. Selenium helps turn on thyroid hormones. These hormones control everything from your body temperature to your mood. It also protects your nerves by keeping the myelin, the nerve covering, healthy. Myelin is an important fatty layer that helps your brain signals travel fast. Without healthy myelin, reflexes slow down, balance gets shaky, and memory fades. And here's an important thing many people don't know. The selenium in Brazil nuts is much easier for the body to use than the selenium in pills or powders. Your body uses it 3 times better when it comes from food. After just 2 weeks, Lorraine told me, "My mornings feel much lighter. I don't need 2 cups of coffee anymore." At her 2-month visit, she had lost 4 pounds, was sleeping better, and her blood tests showed her thyroid was working well again. We didn't change her medicine, we just added one small, powerful nut. But that's not all. Brazil nuts also help your gut, reduce the desire for sugar, and may even slow down cell aging by protecting the ends of your DNA. These ends get shorter as you get older. An important warning: more is definitely not better. Eating more than 2 Brazil nuts a day can lead to too much selenium, which can cause sickness or even nerve problems. 1 per day is the right amount. I always suggest buying them in their shells. The hard shell protects their healthy oils from going bad. For the best freshness, keep them in the fridge. Don't buy big bags of shelled nuts because they lose their strength in a few weeks. So, if you want one small change that can make a big difference, start with this one. Now, let's talk about another strong nut. It looks just like the part of your body it protects, your brain. Have you ever really looked at a walnut? It's shaped like a brain. And maybe that's not just by chance, because out of all nuts, walnuts have the strongest link to brain health, especially for older people over 60. They are full of ALA, an omega-3 fatty acid. These are plant-based fats that your nerve cells need to rebuild, repair, and send clear signals. Your brain does slowly get smaller after age 50, but good food can slow that down and sometimes even help get back what's been lost. One study in the Journal of Nutrition found that older people who ate 1.5 ounces of walnuts every day for 8 weeks improved how fast they could process information by 22%. That's a big difference. It's the kind of improvement you can feel when you talk, think, and remember names. But there's more. Walnuts don't just feed your brain, they protect it. They are full of polyphenol. These are antioxidants that can get through to the brain and reduce swelling linked to Alzheimer's and other types of thinking problems. Every handful is like a shield for your memory. And if you have trouble sleeping, walnuts may help with that too. They have natural melatonin, the sleep hormone that your body makes less of after 60. Eating 5 to 7 walnut halves before bed has helped many of my patients fall asleep faster and stay asleep longer. I often tell patients, you don't need a sleeping pill. Sometimes you just need a handful of walnuts and less screen time. But brain and sleep are not all that walnuts do. Walnuts also help your heart. They have arginine, an amino acid that relaxes blood vessels and improves blood flow. This means lower blood pressure, less stress on your heart, and better oxygen getting to your brain and muscles. Here's a quick tip. Always keep walnuts in the fridge. Their healthy oils go bad quickly at room temperature. That bitter taste you sometimes find? It's a sign the fats are starting to go bad. But a little bitterness isn't always bad. More bitterness often means more antioxidants. So, don't let taste trick you. Let science show you the way. If you want to stay sharp, sleep better, and move with better blood flow, a handful of walnuts a day is a good habit to start. Next, let's talk about a crunchy little helper that makes both your bones and your arteries stronger, the almond. Let's talk about 2 small nuts that have huge benefits, especially after 60, almonds and pistachios. They don't just taste good. They protect the very body parts that keep you moving, thinking, and living strong. Let's start with almonds. A quarter cup, which is about 15 to 20 almonds, gives you almost 100 milligrams of calcium. That's what your bones need most to protect against breaks. But almonds do even more. They are rich in magnesium. Magnesium is like a traffic cop that guides calcium into your bones instead of letting it block your arteries. And guess what? That same magnesium helps relax blood vessels and lower blood pressure. That's good for both your bones and your heart. I once worked with a retired carpenter. He had stopped climbing stairs because of leg cramps and balance problems. We didn't start with medicine. We started with almonds. 3 months later, he was walking daily again. He felt lighter and more sure of himself. But here's what I tell every patient. Eat them raw or dry roasted, and don't eat the salted kinds. Salt cancels out half the good things. And the skin of almonds, that's where the magic is. It's full of flavonoids, which are plant parts that reduce damage to brain cells. When they mix with vitamin E, also in almonds, they double their power to fight damage, protecting your memory too. Now, let's talk about pistachios. These green and purple nuts are low in salt but high in potassium. That makes them a big help for controlling blood pressure. One serving has about 285 milligrams of potassium, which helps your kidneys get rid of extra salt. This gently lowers your blood pressure. They also help your eyes because they have lutein and zeaxanthin. These help protect against vision loss as you get older. And here's a surprise benefit. Shelling pistachios slows you down. This pause helps you eat them slowly so you don't eat too many. It's nature's way of controlling how much you eat. Plus, pistachios are easier to chew, so they are a great choice if you have sensitive teeth or dentures. For older people watching their blood sugar, Pistachios have about 3 grams of fiber in 1 ounce. This helps keep energy steady and reduce sugar spikes. So, what do I tell my patients? Start small. 15 almonds in the morning, 40 pistachios in the afternoon. It's not a diet, it's a way to protect yourself. Next, we need to talk about the first nut that might be harming you, even if it looks healthy and fancy on the outside: macadamia nuts. Now let's talk about a nut that looks fancy but can quietly hurt your health after 60. Macadamia nuts. They are buttery, rich, smooth, and often sold as a special or heart-healthy nut. But for older adults, macadamia nuts can be more of a problem than a benefit. Let me tell you why. First, they have a lot of calories and fat. Just 1 ounce has about 200 calories and over 22 grams of fat. Most of that fat is saturated. That might be okay for young athletes, but for someone whose body burns calories slower, this can quickly lead to unwanted weight gain and higher cholesterol. Worse, that much fat puts a strain on the gallbladder. This is a real problem for many older people who already have gallstones they don't know about. I remember a patient, Mr. Terrence, who came in complaining of sudden stomach pain after snacks. It turned out he had been eating a handful of macadamia nuts every afternoon. He didn't know that the saturated fat in those nuts was causing gallbladder attacks. And that's just the start. Macadamia nuts are dense and hard, which makes them tough on older teeth, especially for those with crowns, implants, or weaker tooth enamel. Even worse, many macadamia nut products are roasted in oil and loaded with salt. This adds to swelling and makes your body hold on to water. Let's not forget these nuts are expensive. And if they are not stored right, their fats go bad. These bad oils can damage cells and increase stress on your heart. There's also the problem of eating too many. Because they are soft and buttery, it's very easy to overeat macadamia nuts. Most people don't stop at 5 or 6. They eat twice that many without realizing it. For someone over 60, that can lead to more belly fat, higher bad cholesterol, LDL, and a slow liver. So, what's the main point? If you really like macadamia nuts, think of them as a special treat, not a daily snack. 1 or 2 on special days is fine. But don't make them a regular part of your diet, especially if you are trying to manage your weight, cholesterol, or gallbladder problems. There are safer, smarter nuts to eat every day. In the next part, we'll look at 2 more nuts that older people often think are safe, but they are not. 2 nuts, both small, both called natural. But for older people, both can cause more harm than good. Let's start with pine nuts. You often find them in pesto, trail mixes, or fancy salads. But pine nuts are linked to a strange and annoying problem called pine mouth. This is a bitter metallic taste in your mouth that can last for days or even weeks. For older adults, this can make them lose their appetite and lose weight without meaning to. This is a dangerous mix if you are already not getting enough food. Worse, pine nuts can interfere with up to 60% of common medicines for older people. These include pills for cholesterol, depression, and blood pressure. The problem is that they affect how your liver works, making it harder for your body to use medicines correctly. Also, pine nuts go bad quickly. Their fats change and create things that increase swelling, especially in joints and arteries. I had a patient with arthritis who loved trail mix. When we took out the pine nuts, her joint pain got better in just 3 weeks. Was it just a coincidence? I don't think so. Now, let's talk about peanuts. Peanuts are not really nuts. They are legumes, like beans. They grow underground, often in damp soil, which is a perfect place for aflatoxins to grow. These are toxins from mold that are linked to liver damage and cancer. And even if you are not allergic to peanuts, they can cause swelling throughout your body. This means more joint pain, more brain fog, and more stress on your heart. Peanuts are also very high in omega-6 fats. Most older people already get too much of these. This upsets your body's balance of fats, which can make problems like heart disease and thinking decline worse. For patients on blood thinner medicine, peanuts can be a big problem. They have vitamin K, which can stop medicines like warfarin from working right. This increases your risk of blood clots or bleeding. And what about peanut butter? Most store-bought kinds are full of unhealthy oils, sugar, and salt. Even the natural ones can be high in salt. It's easy to eat too much, and it's almost impossible to control how much you eat. So, Here's my advice. If you are over 60, eat very few pine nuts and peanuts, or avoid them. Don't be afraid of all nuts, but choose nuts that help your heart, brain, and medicines, not nuts that quietly undo your progress. Next, let's talk about the worst one of all. A nut that is so common, seems so friendly, yet is so harmful that it's at the top of the never eat list: cashews. Of all the nuts I suggest avoiding after 60, cashews might be the most surprising. They look soft, they taste sweet, and they are often on lists of healthy snacks. But here's the truth most people never hear: cashews are a trap for your blood sugar. Unlike most nuts, they are high in carbohydrates, about 9 grams in 1 ounce, and very low in fiber. That's a dangerous mix for older adults, especially those who have prediabetes or type 2 diabetes. One handful can make your blood sugar go up quickly, followed by a crash in energy and mood. I remember one patient, Mrs. O'Hara. She ate cashews every day because she thought they were better than cookies. She couldn't understand why she kept gaining weight and feeling foggy after lunch. Once we took cashews out of her diet, her afternoon energy came back, and her blood sugar became steady within weeks. But that's not the only problem. Cashews are also high in oxalates. These are things that attach to calcium and stop your body from using it. For older people who are already at risk of weak bones, this can quietly make bones even weaker. Over time, it also increases the risk of kidney stones, especially in people whose kidneys are not working well. And here's something few people know: cashews are naturally poisonous until they are processed a lot. They have urushiol, the same chemical found in poison ivy. That's why they must be steamed or roasted before they can be eaten. Most store-bought cashews are also roasted in oil and salted. This adds extra fat and salt, two things most older people don't need more of. And let's talk about how they feel. Cashews are smooth, soft, and easy to chew. This makes them dangerously easy to eat too many of. Many older people eat them without thinking, especially in trail mixes or nut butters, and then wonder why they are gaining weight. Cashews also have things that block how your body digests protein. This means you are not getting nutrients well, leading to weak muscles and tiredness over time. So, what's the final word? Cashews are not a good nut for older adults to eat every day. They are okay as a rare treat in small amounts, but don't think they are a health food. If you want a nut that helps your blood sugar, bones, and digestion, choose almonds or walnuts. They give you good things. Cashews just get in the way. In the last part, I'll review what we've learned and ask you one important question to help you choose your next snack. So, here we are. We've talked about 4 nuts that help your brain, heart, and bones, and 4 others that may quietly work against everything you've been trying to protect. Let's review. Best nuts for older people. First, Brazil nuts, good for your thyroid, nerves, and helping cells age better. Second, walnuts, great for memory, sleep, and blood flow. Third, almonds, good for strong bones, cholesterol, and digestion. Fourth, pistachios, helpful for blood pressure, eyesight, and keeping blood sugar steady. Nuts to eat less of or avoid. First, macadamia nuts, high in unhealthy fat, hard on teeth, and bad for the gallbladder. Second, pine nuts, can interfere with medicines and go bad easily. Third, peanuts, can cause swelling, affect medicines, and harm the liver. Fourth, cashews, make blood sugar spike, reduce calcium, and increase stress on kidneys. Each of these choices may seem small, but over time they add up. They affect your energy, your thinking, and your independence. I've seen patients become clearer in their thinking, more stable, and more confident, not with fancy diets, but with a simple change in the nuts they eat each day. Because here's the truth: your body after 60 is more sensitive. It reacts more, and it really deserves foods that heal, not harm. So let me ask you, which good nut will you add this week? Which one will you finally stop eating? Type your answer in the comments below. I read every story, every change, because they inspire the next person. And if this video helped you see nuts in a new way, give it a like, share it with someone you care about, and subscribe to continue learning how to age with wisdom, not fear. Stay strong. Stay sharp. We are cheering for you.